Mhm. Yeah.
Good afternoon all. Firstly, I'd like to acknowledge the traditional owners of the land upon which we meet, which I'm joining you today. I'm here on campus at Sydney University, so I pay my respects to Gadigal people of the Eora Nation and elders past and present. My name is Michael Doyle. I'm a Bardi Man and Senior Research Fellow at Sydney University. I'm also the co-chair of the Human Research Ethics Committee for the Aboriginal Health Medical Research Council of New South Wales and a board member of the Australian Federation of AIDS Organisations. I'm chairing this afternoon's press conference for the OzSAGE group. I'd now like to hand over to Kalinda Griffiths to give an update.
Thanks, Michael. So before I begin today, I'd like to acknowledge the traditional custodians of the many lands in which we're meeting. I'm coming to you from Larrakia country in Darwin upon the lands of Larrakia people where sovereignty has never been ceded. I'd like to pay my respects to all elders, those of the past, the present and the future, as well as other Aboriginal and Torres Strait Islander people online and watching. My name is Dr. Kalinda Griffiths. I'm an epidemiologist at the Centre for Big Data Research and Health at the University of New South Wales. I'm a Yarwa woman, my family name is Corpus, and my country is in Broome in Western Australia. And I'm going to give a brief COVID update impacting Aboriginal and Torres Strait Islander people. So to date, there have been over 8,500 Aboriginal and Torres Strait Islander COVID-19 cases in Australia. It is a primary remit of the OzSAGE group that no one is left behind. We know that the gap in vaccination rates between Aboriginal and Torres Strait Islander people and non-Indigenous people still continues to persist at around 15%. The fact that it still persists highlights a range of issues with how governments and systems can best support those populations who need it the most. It has been the recommendation of the Aboriginal and Torres Strait Islander OzSAGE working group since quite early on in the pandemic that 95 to 100% of Aboriginal and Torres Strait Islander people over the age of 12 years need to be fully vaccinated before states and territories open up. Preliminary modelling undertaken by Professor Emma McBride from James Cook University has shown that even with 80% of Aboriginal and Torres Strait Islander people over the age of 5 years vaccinated, the risk of death is a little over 30 people per 100,000 people in the population. But if the uptake is 95% in over 5-year-olds, then the risk of death is near zero. So this is what we're going with. 95% of all Aboriginal and Torres Strait Islander people over the age of 5 years need to be vaccinated to ensure that Aboriginal and Torres Strait Islander lives are not lost. Nationally, 58% of Aboriginal and Torres Strait Islander people over the age of 12 years are currently fully vaccinated. 70% have had at least one vaccination. This is still about 15% lower than non-Indigenous people. In those states that have been impacted by outbreaks, we've seen higher rates of vaccination than in other jurisdictions. With New South Wales at 79%, Victoria is now at 80%, and the ACT is at 84% of Aboriginal and Torres Strait Islander people fully vaccinated. The outbreak in the Northern Territory continues, with the majority of cases being Aboriginal and Torres Strait Islander people in outer regional, remote, and very remote areas. 57% of Aboriginal and Torres Strait Islander people aged 12 years and older are currently vaccinated. This is a 4-point increase over the past week, highlighting the major efforts to improve vaccination rates across the Northern Territory. South Australia, before I go to South Australia, there does continue to be about a 30-point difference between Indigenous and non-Indigenous Territorians, still with some communities being less than 40% fully vaccinated in the NT. South Australia has now opened its borders, with the first of the states and territories to do so. So while 80% of people aged 16 years or older have been vaccinated, less than half, 48% of Aboriginal and Torres Strait Islander people are currently fully vaccinated for those aged 12 and older. The gaps between the vaccination rates of Aboriginal and Torres Strait Islander people and the rest of the Australian population requires a spotlight. It's clear that despite being a priority population, Aboriginal and Torres Strait Islander people have been left behind. There are opportunities for people to work together to build cohesive health promotion capabilities and delivering appropriate health messaging and addressing misinformation across the jurisdictions. This needs to be at all levels, federal, state, territory, and local. There's also a pressing need to further support the community-controlled sector to ensure the timely delivery of health services, including the delivery and rollout of vaccines. This includes ensuring people are also able to source and get booster shots. As the borders open up around Australia, there is a major concern for those jurisdictions and areas that have lower rates of vaccinations and widespread disparity gaps in vaccination rates, particularly as different variants like Delta and Omicron arise. The most recent reporting shows that there have now been 826 Aboriginal and Torres Strait Islander cases hospitalised, with 94 people that have been admitted into ICU. 16 Aboriginal people have died, all in New South Wales. COVID is a disease of the unvaccinated. So as it gets into regions and communities with lower vaccination rates and higher risks of transmission, it will spread very fast. In New South Wales particularly, we've witnessed some of the impact that can occur and know that there are devastating consequences due to this disease continuing to spread, particularly through regional and remote Australia. One specific concern is that people are not getting their second jab. There are a number of Aboriginal and Torres Strait Islander people who are overdue for their second COVID shot. While the gap has closed from over 3,500 people with AstraZeneca down to a bit over 1,000 people, there are still gaps between the first and second shots. Approaches to better support communities to improve the uptake of vaccines, which also involves making sure that everyone completes their vaccination schedule, is critical to ensure that people are adequately protected against COVID. Again, this requires appropriate health promotion efforts and support for the community-controlled health sector to provide those required services. We know that Aboriginal and Torres Strait Islander people are at greater risk of transmitting and having worse impact from COVID. This is due to a younger age distribution, higher rates of underlying conditions, and that can impact disease severity caused by COVID, as well as less access to services. This means that there's a need for equitable approaches to ensure that Aboriginal and Torres Strait Islander people can be tested without any barriers. This includes removing costing and access to barriers that may currently exist. We know that having culturally safe health services on the ground to work with communities in regional and remote areas supports vaccine uptake. Going door to door is effective, and we recommend that governments and health services work towards having people in those regions that need them the most. There are still many people in the general population who are not vaccinated, and an even higher proportion of Aboriginal and Torres Strait Islander people unvaccinated, which means that this matter is urgent. We recommend that there is an assessment of each jurisdiction in the decision-making regarding the approach taken to support those populations at higher risk and how this impacts outbreaks. At this point, it should also include a plan for providing booster shots for Aboriginal and Torres Strait Islander people. We recommend that the surveillance of Aboriginal and Torres Strait Islander vaccination and booster rates, as well as the hospitalisations, be presented by state and territory local government areas if appropriate, and that this information is released more frequently. If there are population groups and regions that have lower vaccination rates in other areas, then it is critical to direct information, resources, and workforce to better support vaccine uptake. We also encourage Aboriginal and Torres Strait Islander people to go and get tested. If you've been a close contact, or for those who have not yet been vaccinated, to go get the jab. Any concerns regarding the vaccination can be discussed with an Aboriginal community-controlled health service or a health provider. As states and territories move towards opening up and Australia plans on opening up, everyone needs to work to look after each other. Stay safe, get vaccinated, and leave no one behind. And I'll leave it there, Mike.
Thank you. I'll just hand over to Dr. Francis Nona, who'll give us an update on the Torres Strait Islands.
Right, so good afternoon. My name is Francis Nona. Firstly, I would like to acknowledge the Turrbal and Yagara people who are the traditional owners and custodians on the land where I meet from today, Minjin, which is also known as Brisbane. I pay respect to elders both past, present and emerging Indigenous leaders, and I extend respect to Aboriginal and Torres Strait Islander people who may be present within this Zoom. The Torres Strait and the Northern Peninsula area of Queensland is one of the most challenging logistics-wise for council and healthcare delivery, covering 18 small island communities plus 5 very remote Aboriginal and Torres Strait Islander communities. Overall population of the region is approximately 11,000. Recognition that each location is unique with varying social structures and ways of doing and being, and multiple languages spoken is absolute necessary for successful engagement. Torres Strait Islander cultures are distinct in many ways from Aboriginal communities, and the Northern Peninsula area is a melting pot for both cultures coming together. To date, Queensland Health has made a huge effort to vaccine in all locations, but according coverage remains below levels necessary for full protection, and time to remedy this is short. The high proportion of children currently ineligible for the vaccine is particularly concerning at 25%. The region faces real risk of introduction of COVID-19 from both the south, popular tourist route by road up to the Northern Peninsula area, and by air from Cairns, and to the north, being very close to the Papua New Guinea border, and with people from Torres Strait with strong cross-border family ties and soaring, where there is soaring cases. Should COVID reach the region before a very high vaccine coverage is achieved, a high level of sickness and mortality can be expected. Chronic disease, diabetes, hypertension, obesity, renal disease, and RHD make a large proportion of the community at high risk. Local hospital beds are limited and evacuations can only occur by helicopter or small planes. Prevention is vastly preferred. Also, we're about to embark on cyclone and wild weather season as it approaches, and COVID-19 immunisation is a key step in disaster preparedness. Finally, while there is still a significant way to go and logical challenges to overcome, however, it is great to see number of vaccines administered in the Torres Strait Islands by the Torres Strait Cape Hospital Health District continually increasing, where Queensland Health reports at least 77% of the eligible population, that's 12 years and over, of the Torres Strait Islands had received at least one dose, and 62% had received both vaccinations by 26th of November. Prominent Torres Strait Islander community members, nurses and healthcare workers have been engaged and are working hard to provide strong encouragement and to show that high acceptance is possible even in very challenging logistical circumstances. Communication, leadership, and maximum availability are essential. I shall now pass over to Karina, Dr. Karina Powers.
Hello, everyone. Can we start the slide sharing for the weekly stats? Thank you. I'm an occupational and environmental physician. I'm in Western Australia, and I'm coming to you from Noongar land. I send my respects to all those people. So there have been over 10,801 reported community cases this week. 51.4% of all cases are below 30 years of age. 86.7% of those over 16 are fully vaccinated, and 65.3% of those between the ages of 12 and 15 are fully vaccinated. 2 cases confirmed and 1 remaining. There are now actually 3 cases confirmed for the Omicron variant. There are 29 active outbreaks in aged care facilities across Australia, 107 new resident cases, 36 new staff cases, and 19 new deaths. In regard to school outbreaks, 38.3% or 4,010 cases have been in children 18 and below across Australia in the past week. More than 575 school closures have been reported in New South Wales, Currently, there are 15 schools closed across New South Wales. Twice a week, antigen testing of students in schools and reduced schools quarantining was established in Victoria. Currently, there are 68 early childhood services and 10 school closures across Victoria. Next slide, thank you. You can see in this slide some good news with the doubling times. However, we're wary that there will be negative effects from the relaxed restrictions coming into place. Next slide, thank you. There have been 57 deaths reported this week. There are 466 total hospitalised, 82 in ICU and 33 being ventilated. Next slide, thank you. We'll go to the Omicron presentation, thank you. So this is a new variant of concern. The Technical Advisory Group on SARS-CoV-2 virus evolution met on the 26th of November 2021 and assessed SARS-CoV-2 variant B11529 as a new variant of concern, and World Health Organization has labelled it Omicron. The B11529 variant was first reported from South Africa on the 24th of November 2021, but retrospectively it was identified that this was from Botswana on November the 9th. This variant has a large number of mutations which cause an increased concern for risk of reinfection compared to other variants of concern. There's a likelihood of vaccine escape, and there's a presumed fitness advantage compared to Delta. The number of cases of this variant appears to be increasing in almost all provinces in South Africa. Next slide. The number of people testing positive in South Africa and other countries as well now has risen, and there are studies underway to research the severity and the effectiveness of vaccines for this variant. It appears more transmissible, with an R0 based on preliminary data to be between 10 and 30. There are also noted increasing hospitalisation rates in South Africa. It's not clear if this is attributable specifically to Omicron. Next slide. The PCR test, fortunately, is shown to still detect this infection, and the vaccines are likely to remain effective against severe disease and death, but the data is not yet available. Corticosteroids, antivirals, and IL-6 receptor blockers should still be effective. Other treatments are still being assessed for effectiveness. Monoclonal antibodies may not be effective due to the mutations that are conferring resistance. World Health Organization is monitoring how the changes in this virus affect transmission, disease characteristics, effectiveness of vaccines, therapeutics, diagnostics, and other measures of control. Next slide. There were 2 cases confirmed yesterday in New South Wales, and 1 this morning, I understand, in the Northern Territory, and there are other cases currently under review for confirmation in Australia, I believe. Cases have been detected in Africa, Netherlands, Italy, Germany, Hong Kong, Belgium, Austria, the UK, and the list of countries is growing. Borders have been closed by various countries, and Israel has closed to all foreigners. Travellers from Southern Africa, South Africa, Lesotho, Botswana, Zimbabwe, Mozambique, Namibia, Eswatini, Malawi, Seychelles to Australia must quarantine for 14 days. Travellers from other countries into New South Wales, Victoria and ACT must isolate for 72 hours, but that is pending on advice. Next slide, thank you. So OzSAGE has recommendations to deal with Omicron. We recommend a focus on a vaccines plus strategy. We need a 3-dose vaccination as soon as possible, as soon as 2 months post the 2nd dose, ideally. Vaccinate children 5 to 11, and the government best ensure supply of paediatric doses of the vaccine. We need to think ahead and begin to procure Omicron matched boosters that are currently being worked on by the pharmacy companies. We need to procure the 2 new antivirals that are currently available. There needs to be safe indoor air ventilation, respirators and masks, continued testing and tracing, and administrative controls in border and quarantine. We need to strengthen the measures to prevent transmission to unvaccinated school children, childcare, daycare, with safe indoor air, vaccination of adults and masks. Next slide, thank you. So we recommend that the vaccination of the 5 to 11-year-olds is prioritised and urgent. We want no one left behind. We need adequate vaccination of remote and regional communities. We heard from Kalinda and Francis this morning. They do need our help. The Aboriginal and Torres Strait Islander populations, some of them have a very low vaccination rate that's still to be worked on. And people with structural disadvantage, such as people living with disability, may fall behind with vaccines. We need to prioritise them. A third dose booster from as early as 2 months up to 6 months post second dose, as soon as can be arranged, is needed, because waning immunity begins approximately 2 to 3 months after the second dose of the vaccine. And OzSAGE believes the Omicron epidemic may be curtailed by this third dose. And communication campaign to encourage the third dose is important. We want the government to negotiate for Omicron matched boosters and the new antiviral treatments. Next slide, thank you. High quality community surveillance for Omicron and other variants is needed. We best retain the indoor mask mandates. We need to retain a QR code use, and digital tracing and testing and tracing infrastructure should not be lost. We need to make infected people who could become suddenly too unwell to do this in any case. We need to make, they shouldn't be notifying their own contacts. It's inappropriate and it's not safe. Next slide, thank you. Australia best support COVAX vaccination initiatives in Africa and our other countries, and ensure vaccine equity globally. We need to support Australian researchers and clinicians in their scientific research and control research, and also fund the logistics for our hospitals and healthcare to deal with what could well be increased cases above that was previously planned for. I hand over to Professor Jeff Hamner. Thank you, Jeff.
Thanks, Karina. My name's Jeff Hanmer. I'm an adjunct professor of architecture at the University of Adelaide, a professional fellow at UTS, and an architect. I'm coming to you today from the land of the Wiradjuri people, and I'd also like to thank Adina Aged Care in Cootamundra, who've been kind enough to give me a venue to speak to you today. If you hear a bit of noise in the background, that's an operating aged care facility. Hopefully that won't be too disruptive. Look, getting quarantine right in the current circumstances is really very important. I can't imagine the agony that people who had been planning to come into Australia this week are going through, but it's unfortunately a necessary agony. And we need to make sure that it counts. We need to make sure that quarantine doesn't leak as it has so often in the past. We know that hotel quarantine is leaky. We've proved that time and time again through the pandemic. We know that accommodation, air-gapped accommodation like Howard Springs isn't leaky, and that's been proven through the duration of the pandemic. So what the government needs to do is to make sure we are relying on proper air-gapped accommodation. For instance, the idea of people going through home quarantine in apartments with common spaces which are unventilated is completely unsatisfactory. So we have to pull up our socks on this. It's been something that obviously has been neglected over an extended period. It's very important to get it right now. Australia is historically very good at biosecurity. We are an island, and of course that gives us some natural advantages. We've kept out diseases for over 200 200 years and beyond that, thanks to the people, for instance, in the islands of the Torres Strait. So we need to use the advantages we have as an island and to make sure that they count by ensuring that quarantine doesn't leak. Some hotels might be okay for quarantine, but they all need work to make sure that that's the case. We can't just assume that hotels will work right off the bat. We have one model in Adelaide, which is Tom's Hotel. The hotel's been extensively adapted to make it a quarantine facility. We can't afford to use facilities that haven't been carefully checked and engineered to make sure that they don't leak. So I think, could we have the next slide, please? One of the constant problems throughout the pandemic has been leaks from aircrew, and OzSAGE is recommending that all aircrew be quarantined for 14 days with testing or until they depart the country. And further than that, if we can actually arrange air gap quarantine on an airport, then we would reduce the chance of leaks occurring during transport. Now, I just have to say this, air gap quarantine is a caravan. Air gap quarantine is a motorhome. Air gap quarantine is a mining donga. These are not rocket science bits of technology. That's all we need to do to make sure that we reduce the risk, that we have risks in quarantine. So I think I've said enough. I might hand back to the chair, Michael Doyle.
Thank you, Jeff. Thank you, Karina, Francis and Kalinda. So we do have a Q&A session now. If anybody would like to ask questions, please put them into the chat box. So Francis, I had a question for you. Being from the tropics myself, I wondered if during rain season, people are more likely to be indoors and more likely to sort of be in that sort of risk environment where transmission may occur, and if you could comment on that.
I mean, that's in 4B will side of knowing that coming on to monsoon, but I think what is nice to take away in a sense that it's our way of doing, it's our culture. When we think of modelling systems within the city, we think of where people are going to interact. Where we are from in community, everyone interacts. Everyone goes to the same shop, everyone goes to the same funeral, everyone goes to and that's the same mindset of having, if it's rainy season or not, everyone's going to be in the same place. And that's the most worrying thing. That's why we've got to really support such remote communities. Yeah. Thanks,
Francis. So please, if you do have any questions, please put them into the chat box. Jeff, I have a question for you. I'm going to be asking all the questions this afternoon, I think. I wondered about the 72-hour self-isolation that's now being put in place in New South Wales and Victoria, and if you could perhaps comment on that.
Well, 72 hours is better than nothing, but I think because we know so little about this Omicron variant so far, it seems it would be more prudent to revert to a 14-day quarantine, despite the obvious and heartbreaking consequences of that. But if we don't have effective quarantine, we could have widespread disruption across the holiday season. And I think there's a careful balancing act here. We know everyone wants to get back together again. We all want to have a Christmas with our families. We've got to be very careful that what we do over the next week or so doesn't contribute to making Christmas something less than we're hoping it will be. It is a particularly difficult time for this to happen, but of course, we knew that this could happen at any time, and we know that this will keep happening, and really until the whole world has been vaccinated. And it's very important that we focus on reaching out to our region and making sure that we can help as much as we can to improve vaccination levels across the Pacific and Southeast Asia.
Thanks. I think people are also getting very tired almost into the whole pandemic, and we're all kind of had enough of it, but we do need to keep on going, don't we?
Yeah, I think everyone's very over the pandemic. Yeah, it'd be great if it was over, but it's not. And we really do have to make the best of this we can. And one of the best things we can do at this stage is to make sure that quarantine actually does really work, not leak.
Yeah. We do have a question for Karina about, so what do you think of the Victorian government's wanting infected people to notify their own contacts?
Yes, it's very unfortunate, and it doesn't really add up medically. People obviously who are infected could become quite unwell, and if we were working, we wouldn't expect that someone unwell would be expected to work. We'd want them to stay home, rest, and get better. So asking people who are infected with this serious disease to notify their own contacts is really going to have a lot of holes in it, because they may not be well enough to have good judgment. They may not be well enough to remember everywhere they've been. They may not even be able to speak properly. You cannot rely on people to do their own contact notification and tracing in a durable way when they could become sick at any time. So I would strongly encourage all governments not to drop their contact testing and tracing abilities, and to maintain and, in fact, in the face of new variant, strengthen these abilities.
Thanks, Karina. I might ask you and Kalinda to comment on the following, because it's about Omicron. So we don't know a lot about Omicron yet, but there is concern for Indigenous populations with this new variant, particularly with lower vaccination rates. I wonder if, Karina, you might want to start off just talking about some of the potential, and then Kalinda, perhaps you could talk about specifically what that means for our communities.
Yes, so Kalinda will assist me with answering this, but certainly I understand Aboriginal communities, particularly in some remote areas, they can be very crowded, housing, etc. And we know that this variant appears at this stage to be transmissible between individuals with much greater effect than even Delta. So we really do need to put in all of the controls we possibly can to prevent people becoming sick. And people in Indigenous communities often have multiple medical conditions that put them at greater risk. So whilst some early reports were stating that this appeared to some individuals' eyes to be a mild disease, we don't really have enough evidence of that yet. And in populations with multiple medical conditions or more elderly, we really do have to be incredibly cautious and avoid people becoming unwell and dying, and our hospitals becoming stressed and strained. Kalinda, you will speak to this from your experience. Thank you.
Thanks. And I agree with you completely. And just going back to Francis's point, this is our way of life. If we're on community and living within these remote regions, particularly, then, you know, it isn't a matter of trying to change that the way in which people are living on site. It's actually about acknowledging that the transmissibility is going to be, I guess, much more, deadly. There's going to be a higher risk there for Aboriginal and Torres Strait Islander people. The other thing is around age distribution as well. So we do have a younger age distribution for mob, and because of that, that means that you've got people or the younger crew that we know have higher rates of transmission, because people tend to engage and socialise more as well. And it's not any different within the Aboriginal and Torres Strait Islander communities as well. People are attending the same events, but also that younger crew are spending a lot of close time together as well. So the first things first, recognising that transmission is going to be much higher if it does get out into communities. This is with Delta, and as we start to learn a little bit more about Omicron, if the transmission or transmissibility is higher, again, still, that means that we're at higher risk. And so how do we grapple with that is the question. And this is where the importance of ensuring that we have people vaccinated is front and centre. This is why it is an urgent and almost it is an emergency to make sure that those people who are at the highest risk of those variants that are highly transmissible and have those factors that play into not only transmission rates, but also severity, disease severity as well, are recognised, and the support systems are in place for those communities as well. This means ensuring that we've got community controlled organisations supported as necessary. We also have people on the ground doing the work. And, you know, to be frank, we aren't speaking about a large number of the population. We're speaking about, you know, 3% of the national population. When we talk about communities, we're talking about between 100 and up to 1,000 people, which isn't hard to kind of go around and work with. And so it's just making sure that we have the right resources and support there.
Michael, I'd also like to add, we know that there's a problem with long COVID, whether people are completely asymptomatic or symptomatic, there's a chance, or vaccinated, there's a chance of long COVID developing. So whether people perceive that there's a mild illness for some variant, really as Kalinda was saying, we need to take all precautions, vaccinate as many as we can to try and prevent the complications of this pandemic virus that affects so many organs in the body.
And
thanks, Karina.
I just want to add as well, we haven't spoken about the international, we haven't had the international discussion yet, but ultimately there are lots of nations around the world who have really low vaccination rates. And if there's anything that's really clear about this, is that this is a global issue. You know, we should be supporting our neighbours, and we should be supporting those I guess nations that don't have those higher rates of vaccines through them as well, because ultimately if we don't protect everyone, then we'll miss out. And that's, I think we need to really start thinking about this on a global scale as well.
Yeah, thanks, Kalinda. That leans very nicely into the next question, which is to Francis. So the Torres Strait Islander communities provide eyes and ears across the Torres Strait, which forms much of the border with PNG. Quarantine has worked extremely well with communities and their leaders for decades. Torres Strait Islanders say there isn't enough reciprocity and attention to the risks coming from the north.
No, and it's been that, if I'm answering this correctly, it's been that culturally sensitive in the way we communicate some of this information that comes up from the south. How do we support communities understanding the complex and the dangers of COVID coming into such a region. What community is very good is working alongside each other to protect each other, working with, as opposed to taking the directive orders from organisations and not supporting community within the region. So have I answered the question? Sorry, I missed.
A bit, but I guess part of it is also about the protecting PNG as well, is within the interest. Particularly, you can see PNG from parts of the Torres Strait, is my understanding.
Yeah, absolutely. So there's 3 islands up in the top, Western, Duwan, Boigu and Saibai, and PNG is so close. Some of those families of Torres Strait Islanders are interconnected with PNG. So some of the issues that may come down through Daru, the Fly River and so forth of COVID is on the doorstep of Torres Strait Islanders. But what some of the councils and regions have done up there is put in checking systems to make sure that they can govern what comes into Torres Straits. Right now, there's an absolute closure, which has broken families. Some families are still on the other side of the border and relatives that have loved ones with PNG nationals. But the regional councils, state government agencies and so forth are really protecting that region and doing, watching what's crossing borders and so forth. So it's that governance that will need to, while working alongside those councils, Boigu, Duwan and Saibai, to make sure that people don't come in and expose the rest of Torres Strait.
Thanks, Francis. We might begin to wrap up, but I want to go back to Jeff for a moment and just talk about international vaccine efforts, as you mentioned in your presentation, and how the importance of that even within our own region. We were just talking about Papua New Guinea a second ago.
Well, I think this is, we're not safe until everyone in the world is safe. And this has been apparent from the start, but I think it's taking some people, particularly politicians, a little while to learn the lesson that with a pandemic like this, the chance of mutations is always there. And we need to help people who aren't in a position to help themselves, because we owe a moral duty to these people, but also we just aren't going to be safe until we have got everyone in the world safe from COVID-19. So it's vitally important that rich countries like Australia make a decent effort to help out, not just in their region, but everywhere they can. We've got substantial manufacturing capacity for AZ in Australia. We should be pumping out AZ as fast as we can and giving it to people in developing countries.
Thank you. Thanks, Jeff. So we might begin to wrap up. Maybe the speakers at 1 minute each, if you want to have a final message. I might start with Karina.
Well, as an occupational physician, I very much believe in the hierarchy of hazard control. With the pandemic disease, we need to value every single level of the hierarchy of hazard control. So we need our vaccinations, we need vaccines plus, we need our respirators fitted for our frontline staff and workers who will share air zones with the public or passengers or air crew. This is vitally important so that we do not keep having outbreaks in the community. This is an epidemic disease, not an endemic disease. It doesn't have to be there in the community if we put our levels of control in. That way we can all be safe, including the ones who for medical reasons couldn't have vaccination or were too young at this stage for vaccinations. It's all important. We all need to pull together on this. It's doable.
Thanks, Karina. Francis.
My closing words will be, how do we get into such a situation where we're trying to deliver healthcare and protect loved ones within communities that we tend to throw culture out the window? When we work with communities, Aboriginal and Torres Strait Islanders, we can't forget, because everything up to the pandemic is work alongside, support. But the minute we have such issues, we tend to forget about what culture and their ways of being, our ways of being within community. And by putting that to a side, you're not going to have the acceptance, you're not going to have the support of community. When we go into these communities, we've got to work with, not on. And I think we tend to forget that when we're in such a hurry with big organizations delivering healthcare. You see success when you work with communities, driven by community-led interventions. We can't go in and think that what we think will work. And that's why we haven't seen the uptake that we have. The minute in Torres Straits we had community-led strategies, all of a sudden the numbers started to go up, and it wasn't rocket science. So that is an example of we've got to be supportive, not telling what communities should be doing.
Thanks, Francis. Jeff, a final word from you, perhaps?
Sure. Thanks, Michael. I'd just like to remind people that we've got lots of caravans in Australia and we could be using them. Now's the time to sort of get something happening so we can stop leaks in our quarantine system. It certainly isn't rocket science. Thanks very much.
Thanks, Jeff. Kalinda.
I just want to say that for those communities that need it the most, the issue here is around governance. And I really think Francis hit the nail on the head in terms of saying, well, you know, Aboriginal and Torres Strait Islander people know what's best for Aboriginal and Torres Strait Islander people. And this is not any different for those other populations that are at high risk as well. So we are speaking about, you know, those people who are differently abled, those people who live regionally and remotely as well. Everyone knows what needs to be done. I think our best efforts can be in resourcing those needs through the appropriate governance processes. This is what can assist in improving vaccination rates, supporting systems if it does get into communities, and making sure that we're heeding the advice of medical experts as well.
Thank you, Kalinda. So that concludes this afternoon's press conference. So if you would like any further information, you can go to the OzSAGE website, and a recording of this press conference will be available on the website in the next 24 hours. So thank you, everybody, and stay safe.